Good morning, everyone. Thank you for attending the Healthicity Compliance presentation, 4 Smart Strategies for Better Employee Training. My name is Justin Larson, and I'll be our facilitator today. A couple of items to mention before we begin. Today's webinar will be about 40 minutes, then followed by a Q&A session. Your line is muted, so if you have questions, please send them via the questions box, or feel free to email your questions after the presentation. Please note that there will not be any CEUs issued for today's webinar. Also, we will be emailing everyone after the presentation with links to the webinar recording and the presentation slide deck so that you can download it. Our presenters today are CJ Wolf and Greg Waddups. CJ is a healthcare professional with more than 20 years of experience in hospital revenue cycle management, practice management, compliance, coding, billing, and client services. He has been providing healthcare consulting and solution services to hospitals and physician organizations throughout the country. Greg Waddups, PhD, has spent the last 20 years working with schools, universities, and businesses developing effective educational and training programs. He has a special focus on using technology to improve adult learning and development. With that said, I'll turn the time over to CJ and Greg.
Thank you, Justin, and welcome everybody. I'm excited today to be presenting with Greg. We have a real expert here on the science of learning, and I think we're going to learn a lot just about best practices in learning, and then try to apply that in a compliance setting with training. And we're going to cover 4 main pillars, and Greg's going to lead us off in some of that, and then I'm going to try to apply those principles to compliance programs. But the 4 pillars are: 1, formal and informal learning; 2nd, personalized learning; 3rd, assessment and feedback; and 4, using technology in learning. So why don't we go ahead and get started with the formal and informal learning, and I'm going to turn the time over to Greg at first. Go ahead, Greg.
Thank you, CJ. Couldn't be more here and to be talking about these important topics. I want you to think just for a minute about the last 30 days. What knowledge gaps have you had? How did you fill them? What information sources did you go to? Were they formal learning environments? Did you go to a classroom? Did you find resources online, read books, trade magazines, and the like? Did you talk to a colleague? All of us on a daily basis have gaps in our knowledge. We need to learn new things. The question is, how do we learn them, and what sources do we go to learn them? And that sort of underlies this notion of formal and informal learning. There's been a lot of research done on this topic, and it turns out that 70% of learning is more of an informal, on-the-job learning. That is, you have a problem come up within the context of your work, you go out and you find resources, whether it's online, in a book, or something like that, and then you gain that information and you apply it. 20% is through social networks, through peers, mentors, coaching. So you go ask a colleague who has more information, or you're that colleague who provides more information for someone. And then 10% of learning is actually formal, in-class learning, where there's a teacher, a curriculum, and the like. So as you think back on those 30 days, the question I have for you to kind of consider is, what was the balance between formal and informal learning? How did you spend a lot of time in the classroom? Did you talk a lot to other folks and get coaching? Or did you access the information on your own? So I want to kind of go into a little bit more detail about each one of these and give you some ideas and some thoughts about the best ways to use formal and informal learning to improve yourself, improve your practice, improve your work environment. So that 70% of learning on the job is really, really important, and sometimes we forget about that, forget about how important it is. But let's think about it. When you learn on the job, you have a problem that comes up, an issue that you need to solve. Where do you go to get trusted information? And that's the key. How can you identify valid, trusted information? Then, is it the internet? Is it trusted government and industry sources? Is it the are there do you have books, trade magazines, other kinds of things? So the key to that then is identifying those sources, applying your knowledge in that context and saying, okay, I've learned this piece of information, how do I apply it? And then what's key, and I think a lot of people forget, is how do you save that information? How do you keep track of it so you don't have to do it over and over again? Once you've solved a problem, you've gained some knowledge, how do you keep track of it? So we need to think of informal learning as purposeful, as solving everyday problems with information and finding that information. So that's about 70%. You know, that can be plus or minus for different people. The other kind of 20% is coaching and mentoring from coworkers or from people in your network. You know, asking questions from more experienced coworkers, participating in networks or groups online. Many of us are members of professional groups. When you attend conferences, I think this is really interesting. Many people I talk to at conferences, they gain more knowledge and information in the hallways than they gain in the actual workshops themselves. And so that kind of informal learning where you're learning from coworkers and applying information is really, really important. And how do you then capture that learning in your network? How do you use it and reuse it rather than having to go ask the same person the question over and over again? So that's key as we think about formal and informal learning. So the key then is, and I'll sort of just summarize, is you need to clearly identify the questions you have. Make sure that you really understand what your gap is. Find credible resources of information and apply that information back into your life. Something that we often forget too is storing that knowledge, archiving it, making it available. Is it in a spreadsheet? Is it in a Word document? Do you save your, do you have a place where you save bookmarks? These things are all really important. And then key to this is sharing your newfound knowledge with others, getting on those networks, talking to people and learning. That's the way you create a learning organization. The final thing that I'll sort of mention is formal learning. Now, just because it's only 10% doesn't mean it's not important. It is important for your success. Getting certified, going to taking courses, developing your competency is key to your professional development. But balancing formal and informal learning is key. Many times when people think about learning and training, they think about that 10%. What I'm suggesting here is that you think about the other 90. It's crucial. So finally, things to consider. What are your sources of formal learning? How are you gathering? How does your organization conduct formal training? Is it effective? Is it targeting the needs of your organization? How are you engaging in those? Are you getting the certifications you need? Are these programs aligned to individual and organizational needs? How are you assessing the effectiveness of these formal programs? It's key if you're going to do formal learning that you assess their effectiveness. How are you leveraging informal learning? How are you storing information, keeping information, creating a learning organization? And are you adequately catching that institutional knowledge? And finally, how are you creating networks to coach and share? Those three things, informal learning, coaching and networking, and formal learning are the things that make that 100% learning and development cycle that all individuals and organizations need.
What our audience can't see is me shaking my head as Greg is talking, because I feel like this is the path that I've taken over many years in compliance. As I was trying to learn compliance and trying to train folks within the compliance context, everything that you said just makes a lot of sense to me. The formal learning was really important. The certifications, those sorts of things are a really good foundation. But most of my learning took place when questions came in on the hotline. And then I would do research. And just like you're saying, I had to find trusted resources to go to. Do I go to the government? Do I go to this trade organization, this professional society? So all of those things are really ringing true to me as an individual, and I would gather that a lot of the folks on the webinar are probably nodding their heads as well. So given some of these concepts that Greg has shared with us, I wanted to try to apply some of them to the world of compliance. As we know, compliance programs have 7 elements to be an effective compliance program. One of those 7 is training. We were joking a little bit before we started the webinar that historically when I've gone out to do training, quote unquote training for doctors, I've had some doctors say, no, you train a dog. You're here to educate me. And I get that point, right? Now I know in the compliance world and in the 7 elements, it's always referred to as training. And we might get hung up on the use of that word, but what I think is really important for us to learn today is that it's not just getting people to understand something intellectually, it's actually getting behavior to change. In a compliance program, what the OIG, what the government enforcement agencies expect, and what I think each of us expects of our own compliance program, is that over time, our education efforts are changing behavior, whether that's billing differently or treating HIPAA privacy differently, following policies and procedures. So I wanted to share with you, to use some of Greg's principles, formal and informal. I wanted to start a little bit with formal. So attending in-person conferences, you know, Greg was talking about some of the value of conferences is the networking that takes place afterwards. I was just at a conference, presented a session, and then a gentleman came up and said, look, I'm getting into compliance as a profession. I really need a coach or a mentor. So he used those words that you then have just told us on this slide. And I think we then had about a 30-minute conversation that was much, I think for him, much more beneficial than the hour-long session that I had just done as the formal. And like you said, it's not that one's more important or one's less important, but I think in compliance, we often focus on the formal and then think we're done. Right? Okay, you did your annual compliance training, you signed the form here, your attendance sheet, let's record that, you're done. Well, that might be better than nothing, but it's not the best, is what I'm hearing you say. It's how do you then utilize those informal. So some of the formal things here, attending in-person conferences, coming to webinars like this, I think you would consider more of a formal session, training sessions. And then I've put up here a couple screenshots of some formal resources that you might not be aware of. If you Google or if you just go to the OIG's OIG Compliance 101, they have these videos that you could use, and these are different topics. So these are each about 4 minutes. So they're nice little snippets that you could maybe send out in an email, or you're going to a department meeting that you attend, or you're going to the board and you have to report to the board this quarter, and maybe you just want to introduce a concept. These are nice short videos that the OIG has put out. Some of the topics are importance of documentation. Another one of these videos is on the anti-kickback statute. Another one is on the exclusion authority of the OIG and what that means. Physician self-referral law, known as the Stark Law. The False Claims Act that we talk about in many of our webinars. Implementing the effective compliance plan. And then there's a short little one for board members as well. So these are great little ways to get some formal authority from the OIG and some formal thinking on training. The second one in the middle there is a specific set of materials that the OIG has published that is for healthcare boards. So one of the things we're going to get to later is talking about personalized learning and making sure you know who your learner is. So I'm pointing out some of the formal resources that you want to be thinking about your audience. How I'm going to approach my board is going to be different than how I approach a doctor. And the third set over on the right, that third screenshot from the OIG's website, is some materials they put out just for physicians. Now, it's foundational. It's pretty general in compliance training. So this might be a good resource to use maybe for brand new physicians, or let's say you're training residents. And then we're going to talk a little bit later in the webinar about how you can then drill down and really give some good personalized learning depending on the type of specialty or physician that you are. So those are some thoughts on formal. Some thoughts on informal comes from the Inspector General himself, Daniel Levinson. He said this at the HCCA's Institute. There are many CIAs. We know that CIA is a corporate integrity agreement. These are documents that are published. There are many CIAs with settling companies that will provide incredible detail to you on how to craft the best possible compliance program for your own enterprise. To me, Greg, this is one of those examples of an informal learning. What I do with new CIAs is I read them, and I'm seeing these are companies that have gotten into compliance trouble, and then the government is forcing them more or less, this is your corrective action plan, so to speak. You have to follow this document for the next 3 or 5 years, for example. And I learn a lot as I read through there. It's what the government expects of programs that have gotten into trouble. And I don't want to get into trouble, so I want to prevent it. So I'm reading through these corporate integrity agreements to learn how to best provide training or any other elements of a compliance program. So I think this is a really good resource for informal learning. Here are some others that came to mind. I know many of you on the webinar could come up with many more, and I'm sure you have them. You mentioned, your favorites and websites and those sorts of things. It would be kind of an interesting survey to get all the favorites from the listeners and see where we can learn from each other. But some national websites, the OIG, of course, is a great resource. CMS, Center for Medicare and Medicaid Services, HHS.gov HIPAA, that will help us go to OCR's portal and understand HIPAA, privacy and security. And then some industry resources. So our own website at Healthicity, the HCCA, the Healthcare Compliance Association, is a great resource. And then the AAPC is another example. And like I said, there's many others. Then I also thought of some local regulatory entities. So many of us are working in regional organizations, or you're in one state, or you're in a healthcare system that maybe covers 2 or 3 states. If that's the case, you really want to look at your local state Medicaid website as a valid resource, because the regs and the rules in compliance for you in your state are going to be different from others. So these national conferences might not help you when it comes to local regs. And then the local MAC, the Medicare Administrative Contractor, also has are set up by region, and their policies and procedures will be specific to you. In addition, I listed some of the foundational documents that I found useful as I was learning about compliance and trying to implement a compliance program. We all know that one of those foundational documents is the Sentencing Guidelines, Chapter 8. I mentioned CIAs. Along with that, our settlement documents and court documents. They give you some great specifics by specialty or by issue that you could use. The OIG, as we all know, has the program guidance documents that they've published. The Federal Register, proposed and final rules, conference handouts are a great way to get information. The OIG audit and studies that they publish. Right before the webinar, I got online to see what some of the most recent ones were, and there was one that was a compliance audit of a hospital. This was published just 3 days ago that I thought was interesting. There's another one on sleep health center. So if you are providing sleep services or sleep therapy, those types of things, that might be an important report to read. But constantly looking at those resources are important. I mentioned local contractors. They also have newsletters and alerts and announcements. And then, Greg, you mentioned some of these, but I find discussion boards, listservs, chat rooms, blogs, etc., to be useful, not necessarily to be the authoritative guidance, right? You got to beware, because we all could say anything in these chat rooms, but they can often lead you to the right resource, or it lets you view an issue from a different perspective, maybe one that you hadn't thought of. So just being, closed off in your closet trying to do compliance is not necessarily the best way. And then you also talked about sharing. There's a quote that I love from Joseph Joubert that says, "To teach is to learn twice." There's a lot of learning that comes from teaching, yes, right? And so if you want to solidify things in your own mind, teach it. Another thing in medical school, you had to see one, do one, and teach one. So what that means is when you're learning a new procedure or a new technique, the first thing, and this is a pattern that was drilled into you over and over again, you saw one, so you saw someone else do the procedure, then you would be involved in doing one, and then you'd be involved in teaching one. And that is a great way for this informal learning. So those are just some thoughts from a compliance perspective. Let's move on to the second major pillar, which is personalized learning.
Great, thank you. CJ, those were great examples, and I think ones that we can apply as we try to build a full learning program that considers both formal and informal learning. The next pillar is this notion of personalized learning. And there's a concept and a model for doing this, and it has a few principles. The first one is you need to analyze, you need to design, develop, implement, and evaluate. And so to personalize learning for an organization, you need to be always in the process of analyzing, designing programs, developing them, implementing them, and evaluating their effectiveness. That's called the ADDIE model for those who are interested. So personalized learning first is understanding organizational needs and understanding individual needs. So organizational needs will need to be in the process of really analyzing your organization. No two organizations are alike. So a plug-and-play program won't work for any given organization. You need to have some flexibility, and you need to really understand what your needs are, analyze those things, and develop and design and implement a program accordingly. The same thing is true with individuals as well. No two individuals are the same. We need to be able to diagnose what their needs are, what their wants are, what their experience is, and how we can implement a program that's flexible enough that it will meet their needs. Oftentimes with formal training, it's so general and it's not specific enough that you get complaints from people. They say, this isn't for me, this isn't designed for me, I already know this, or it's so much out of my league that I can't really engage and understand. So that's why it's essential to develop personal learning plans and have the ability within your learning design to be flexible and to implement flexible programs. So here's some things to consider. I've mentioned flexibility several times. You need to have both informal and formal learning that's flexibly applied to your organization. You assess those needs and really understand is the second one. The third one is creating personalized learning plans. So next slide. So personalized learning plans allow you to target what the individual's needs are, provide them with the education they need and the access to resources to what they need. So if you consider different roles in an organization, they might need access to different resources and networks and courses. So we're thinking a little bit more generally about how we would train rather than just providing that once-a-year training. The fourth thing is really sharing insights. Sometimes we get stuck in our desks, in our offices, and we're really not facilitating the sharing of insights with other people. Do we have technologies internally that allow us to capture the best practices? Are we sort of given incentives to share our insights and to help grow other people? Sometimes, it's not just the folks that are in charge that have the most information. Sometimes it's people who are specialists, who are on the ground. So having the ability to gather insights and share them with each other, either through technology, hallway conversations, or in meetings is really important.
Great. So this next slide I wanted to use kind of as a segue because I think you're spot on in that compliance officers, compliance programs are expected also to make their training and their education personalized. This is a quote from the OIG stating that the compliance officer's primary responsibility should include, and they name the 7 elements, but one of those is developing, coordinating, and participating in a multifaceted educational and training program that focuses on the elements of the compliance program. So again, I want to reiterate, I think just saying, okay, let's send out the HIPAA training for the year and be done with it. That's not what this message from the OIG is saying. They're saying it should be multifaceted. It should, you should be involved in coordinating and participating. So some of the best practices from the OIG, this comes from the hospital compliance guidance, and they stated over on the right, hospitals that fail to train and educate their staff risk liability for violation. So they feel that the training and the education is a core element in order to have an effective compliance program. I'd like to talk about the second bullet. We're going to use this same slide in some of the other pillars and other sections, so I'll get to some of these other bullets. But the second one is really one that I think is what you just said, and the OIG has said it. Try different approaches. Use real-life examples. So I wanted to try that with you. Let's assume we had to teach, or we wanted to. We all know medical necessity is a very important part of a compliance program, and that message goes to many different individuals in the organization. You might want to train the board about medical necessity, and then I just picked a specific kind of physician, a gastroenterologist. The approach is going to be completely different, in my opinion. Here's an example of from the board. This is a document published jointly with the OIG on how boards are supposed to have oversight of the compliance program. And they say a healthcare provider can be subject to exclusion from the federal healthcare programs if it provides medically unnecessary services or services that fail to meet professionally recognized standards of care. The board generally just needs to know this, right? They need to know that hopefully the organization has implemented some processes and procedures that allow for monitoring of this. Do they need to know the intricacies of what that means for a gastroenterologist? Probably not, unless there's some investigation going on that they're overseeing. But the gastroenterologist, here's an example of how you might approach him or her. Medicare requires that you and the procedures you perform be medically necessary. Okay, yeah, everything I do is medically necessary. I wouldn't do it if it weren't medically necessary. I've heard that a million times. Okay, I appreciate that. Thank you, doctor. Let me tell you what Medicare specifically means when they say this. Let's say, doctor, that you're going to be doing a endoscopic band ligation. Okay. Obviously, when you do band ligation, there's sometimes bleeding from the site where you ligate, and controlling that bleeding, Medicare considers included in the procedure code for the overall procedure. Okay, so report, even though there's a separate procedure code for control of bleeding endoscopically, you're not allowed to report it. That's essentially what the second bullet is saying. And then he says, well, aren't there any exceptions? Well, yeah, here's an exception. If it's necessary to repeat that endoscopy to control the bleeding at a separate patient encounter on the same date. So let's say this is an inpatient, you did a band ligation in the morning, the patient's having some complaints and concerns, and you determine that they're bleeding still. You take them back to the procedure suite, and you do this repeat, and it's all on the same day. Well, Medicare here says you can use modifier 78. But this is a specific example talking about medical necessity when it's appropriate and when it's not appropriate to report the procedure. The board doesn't need to know that level of detail, but the gastroenterologist might. So, but this same concept can be applied to anyone that you're teaching and trying to educate on the concept of medical necessity. It might be a nurse, right? It might be a coder. It might be a different physician and a different specialty. But that personalized learning, I think, is essential. The compliance pill is hard for people to swallow anyway, right? No one flocks. You announce compliance training, you usually don't get trampled over by a mob trying to rush into the compliance training, right? So it's a hard enough thing to get people to do. Don't give them reasons not to come. And so make it cater to them. Make it as specific and useful for them. If you have to break it out and do a separate training for the coders and a separate one for the physicians, then do so. Don't try to do one training that's going to encompass everybody. I think that personalized element is really important. And so with that said, let's move on to our third pillar of assessment and feedback, Greg.
Yeah, just one thing about the personalized learning that I'll just say is the idea of role-specific training is really, really important. And the technology tools you use, the design of your program, it needs to focus on the individual needs, and often those needs are role-specific. So thank you for that.
Yeah, good point.
Assessment and feedback, key to all of us as we learn, and both in the formal and informal environments. A well-designed formal training program allows for the learner to be assessed, to say, yes, I've learned something and I've proven my knowledge. That's key to a formal learning program. Informal learning is a little more tricky, and it relies, I think, on the individual to be open to feedback and to ask for feedback, and to, as you talk to other people, it's sort of an attitude of wanting to learn more and to understand. kind of this openness to feedback. So those are, I think, important concepts of assessment and learning and growing and development. In addition to kind of learning assessment, there's overall program assessment. Any program that you implement, whether it's formal or it's informal, needs to assess the effectiveness. And the effectiveness might be a survey. It might be being able to document actual behavior changes and changes in your organization. And I think more and more we're needing to be able to assess the effectiveness of programs, not just by thumbs up on a survey or a pass the test, but on, is our organization making improvements? And that's why capturing the informal inputs is extremely important in order for you to track and assess how those things are leading to changes as well. So a couple of things to consider while doing this. So you need to make sure as you're designing formal courses, whether they're online or face-to-face, that you get feedback. You find out whether the program was any good, how you can improve it. Having this openness is key. You also need to get feedback on learning, so well-crafted quizzes and those kinds of assessments also key. In addition to that, identifying networks and associations and to get informal input to help you further develop your competency. You know, asking a question in an internet group or a network of some variety online, opening yourself up to getting feedback. Sometimes you become a little vulnerable, but it's important to do that. The third thing is keeping track of what you're learning from these informal interactions. Do you use technologies? Is there technology in your company that you keep track of? I've seen folks creatively use email and spreadsheets and other things to keep track of their learning. But is there a technology in your organization sponsors that helps you keep track of that? Keep track of the feedback you're receiving so you can continue to learn. And then being clear about how you evaluate the effectiveness of your program. Remember I said before, there's really 5 key elements of developing a great program. Assessing the need, designing the program accordingly, developing and then implementing, and then the final thing is evaluating. So having evaluation procedures that look at the effectiveness of the program and the growth and change that's happening in your organization. If you can document that, then your compliance program is going to be particularly powerful.
I agree with that. I think being able to demonstrate that your training and education efforts are effective is essential, not just to say you've checked a box. And an example that I think falls into this, and you can comment and tell me if you think otherwise, but I was the director of billing compliance for many physicians, and we were doing regular billing audits, right? And then we would educate, and I called it the audit educate cycle. Mm-hmm. So it never really ended. It was this kind of circle that went around and around and around, and it was never ending because we were always trying to improve their documentation and then their selection of the codes. Mm-hmm. And so we would monitor the error rate. And so over a year's time or over 2 years' time, we could demonstrate that the auditing followed up with quick education that was specific to that physician. So we weren't going in and say, here's how to use modifier XYZ. We would say, here's your audit of 10 claims. On these 2, you use this modifier incorrectly. This is how you do it in the future. Right. It was very specific to their encounters, their patients. It was their documentation to kind of tie in this personalized learning. Right. And then we would audit again 6 months later, and then we would educate again, and we would see this improvement. And I think that's what you're talking about, is these metrics to evaluate the effectiveness of that training.
Exactly. And having that process and being able to document what was included in that process of education is key. I'm guessing there were formal types of training.
Yes.
There's also conversations that they had with you and maybe with colleagues. They might have looked up information.
Exactly.
To help improve themselves.
Yeah.
So that continual improvement process is key.
Terrific. So I'm coming back to this slide that we shared previously, but I want to focus on that last blue portion, focuses on the elements of the compliance program. I think this is an important aspect of assessing the program. So is my training is a piece of the compliance program, right? It should be contributing to the effectiveness of the compliance program. So it's not just did everyone score 100% on the quiz at the end of the training, it's was that translated into behavior change, right? We went out and trained on the hotline. Well, are we seeing people use the hotline? That would be one potential measure of an effectiveness of the program, and that can all be tied in together. This other slide we've also shared, and now I want to talk about three of the other bullets on here. The first one, the second, and the third. The third and the fourth. So one, the OIG asks or recommends that you regularly review and update the training programs. So we all know that in compliance, regulations are constantly changing. And so what was true a year ago might not be true today. And so if it was in your training last year, you need to have somebody reviewing that, number one, just for accuracy, but also, should we tweak this? Should we change it? Have we beat that principle to death, and now we need to go on to another principle? The third bullet, make training completion a job requirement. So that's kind of the checklist thing. I think we all do that. Hopefully you do, because you have to get completion of training, right? But that to me is like a base, that's like the ground level. That's not where we want to end up. That's just the beginning. And then the fourth bullet, test employees' understanding of training topics. And Greg, I don't know if you could comment on if it's effective to have a pre-test and a post-test to demonstrate that at least intellectually from the beginning, you know, at minute 1 versus minute 45, there was some intellectual learning. Now that might not always translate into behavior change, but is that something that you see as effective?
There are a couple of things with that. The first thing is, if you do a pre-test and you find out that folks really understand the information, then you can tailor that education and only hit the pieces that they really need. So I think that's a key component. The second is it's really good as a developer of educational programs to be able to measure cognitive change. Cognitive change kind of prefigures behavioral change, and so if you can track, they didn't know something, now they know it, then they're going to apply it.
Gotcha.
That's key.
Good. So for some of you that want some more formal endorsement maybe of certain practices, I found this interesting site from the New York Office of Medicaid Inspector General. They have on their website some best practices that they've listed, as well as what they call opportunities for enhancement, areas to improve, and then identified insufficiencies, so some not so great practices. And we're going to share that with you in a moment. But that is, I think, key is looking at best practices in the industry. This also comes from the OIG's compliance guidance. We recommend that the individual policies and procedures be coordinated with the appropriate training and educational programs, with an emphasis on areas of special concern that have been identified by the OIG through its investigative and audit functions. So I mentioned a couple of those audit studies. The sleep health was one. If that's an area for you, you might want to review that audit, make sure your policies and procedures are up to date, train and educate to those policies and procedures, and then have some sort of measure that you can monitor whether that whether a certain behavior has changed or not. I like to think whenever I design a training for compliance, I like to begin with the end in mind. So what do I want this person to do after sitting through this, right? I want him to use the modifier 59 appropriately. So I define what I want the end result to be before I ever begin designing the training. Or I want them to maintain PHI as confidential. I want them not to put PHI on a personal device such as a phone or a personal laptop. So I think of what is my end goal from a compliance perspective, and then I try to train or educate to that end goal. The government has provided some questions. You mentioned program evaluation. Okay, well, the government has put some questions together. This first one has to do with, are your trainers qualified? to conduct annual training. So these are some self-assessment questions that you could use when you're evaluating your own program. Number 2, has the program evaluated the content of its training on an annual basis? We already mentioned that. 3, has the compliance program kept up to date with any changes? We mentioned that as well. Number 4, has the compliance program formulated the content of its education to consider results from its own audits and investigations? So it's one thing to give general compliance training, but isn't it more powerful to be able to say, you know what, we did a HIPAA audit last year and the Department of Neurology really struggled with X. Wouldn't it be great that when you go do the training for that department, rather than giving a generic training on HIPAA, you focus in on what your audits and investigations found? Okay? To me, that's what the government is saying here. Trends in hotline reports. What if you get a slew of hotline calls about subject Y? Well, maybe your training should be on subject Y. So it's using some of these other metrics and tools within your compliance program. You're assessing the program, and then you're using that to create training that's specific and focused. And then 2 others, has the hospital evaluated the appropriateness of its training by reviewing the length? So one thing I always used to tell people is, if I had to have a choice between a 1-hour mandatory training and somebody like a department chairman giving me 10 minutes at their monthly department meeting, I would take the monthly 10 minutes by far. Now, a lot of you say, no, we have to do 1-hour compliance training. Well, can I tell you what? I've done this before. And I said, can I just serve, department chair, can I just get 10 minutes on your agenda every month? Just 10 minutes. I'll tell you what happens 90% of the time. That 10 minutes turns into 15 and 20, and they want me to come back because you're giving them a taste of some very effective compliance training, and then they want to use that information and they have more questions. And so then they call me in between those months, or they ask me to come back. So I think that's more important. And so consider the length of the training. And then the last one, does the hospital seek feedback? You mentioned this as well, surveys and other things to get feedback from the learners. So let's move on to the 4th pillar, which is technology and learning.
Okay, thanks, CJ. If I'm participating in this webinar, I'm thinking, this is a lot of great information. How do I apply this? How do I use it? What tools and technologies might be available to help me with this? And that's really what this 4th pillar is about, is helping you identify the technology and tools that you need to be effective. Many of you probably have access to a learning management system. And most LMSs, or learning management systems, have the ability to track formal learning. So it gives you the ability to track that 10% of learning, and that's important. What happens if you had a program that allowed you to keep track of more of these informal learning? It's important that as you develop your learning management system and your learning program, that you find ways to keep track of these sharing, coaching and sharing opportunities that allows you to keep track of resources and the use of resources that might be necessary. This will allow for you to personalize the learning, just as CJ is talking about with his examples. How do you amass the resources and to the problems that have been identified through audits and the like? Also, when you're looking for technology, you need to have a tailored environment. You need to be able to create, not just shoot out courses, but create tailored learning plans that would say, okay, for the neurology department, here are the 5 learning things that they need. Here's a network of a list of resources that would be useful. Here are some coaches that they can have access to that we can help them, and then you can track the use of those things. Having a full plan like that and having a technology that will enable that is absolutely crucial. Your job's hard enough as a compliance officer, as a trainer, as an educator, to just get people up to the 10%. It's not possible really to do the 100% without the right tools, the right technologies. And so I'm suggesting that it's an important thing for you to consider. So a few questions. Does the technology used for learning facilitate both formal and informal learning? Are there opportunities to collect and to facilitate coaching and sharing opportunities, that 20%, to provide access to valid, reliable resources like CJ's provided, and to track whether people use them and get people's input and feedback about them. Does it allow that? Does it allow for personalized learning? Does it allow for you to create learning plans that would be specific for an individual, for a group, for a department, and allow you to group them accordingly? It's very, very important that it does. The final thing is there a strong assessment reporting set of features? You know as well as I do that as you've trained people, many folks will say, I need a report. Who completed? How did they do? Is it making a difference? Many of us keep spreadsheets and email messages and things and try to pull it together. A good learning management system will allow you to just amass that and shoot the report out in a matter of minutes rather than hours. So those are key. Technology should be your friend. It should enable you to be successful, and to collect that 100%. The 70, 20, and 10. Your LMS needs to allow you to collect both formal and informal learning and to keep track of that.
Great. So back to this quote from the OIG. So a compliance officer's responsibilities include coordinating and participating. So I wanted to focus on those words of coordinating, and I think technology is key to help you coordinate. Okay, there is the mechanics of running a training and education program. Technology can help you with that, so you can focus on the real learning, right? Don't spend all your time and energy on the mechanics of gathering emails and spreadsheets. Let that be done by the technology, and then you can focus on the behavior change and what you're trying to accomplish through your educational efforts. Here are some examples. Again, this same slide, I want to look at the second to last bullet. Maintain documentation to show which employees received training. From our New York OMIG website that I shared previously, here's some best practices that they highlighted in their view. You can see number one, use of an electronic training and education system that tracks all these mandatory trainings. They thought that was important. 1A, it's customized to the organization. You talked about that, Greg. Be flexible and customize. 2, the results of online compliance education quiz scores are analyzed and tracked to identify areas of weakness. So if you have some sort of post-training assessment and everyone's missing question 7, that might tell you something, right? Either the training needs to be updated or you need to go back and do something, follow-up education, because question 7 is throwing everybody off, or maybe you need to revise it. So, but analyzing and using those metrics and that data in a smart way. That's hard to do with paper quizzes without putting them into spreadsheets and that sort of thing. Number 3, the compliance training and education materials are tailored to the needs of differing organizational levels. So this is kind of bringing back some of these other pillars. So how do you track over multiple years? And I've shared this concept before with the DOJ declination. So what a compliance officer wants to do with their compliance program and what organizations want to achieve is, if there is a misstep, you want to be able to demonstrate it was a bad actor. It was a bad apple. That's not systemically our culture or our behavior. Well, the DOJ declined to enforce some mishaps against Morgan Stanley because Morgan Stanley was able to demonstrate an effective compliance program. And one of the key things the government quoted here was their ability to recall all the trainings that were done between a 6-year time period. And they were able to say Morgan Stanley during 2002, 2008 trained various groups of so-and-so on these policies 54 times. During the same period, they trained Peterson, this is the individual who had committed the wrongdoing, trained that individual 7 times and reminded him to comply at least 35 times. I can tell you what, looking from 2002 and 2008, if the government came knocking now, this would be a hard thing to do with paper files and spreadsheets on multiple people's hard drives. If you have a centralized LMS that you're referring to, you're able to, with the press of a few buttons, pull up this kind of recorded history. So I think technology can really help your compliance program demonstrate it's being effective. So that is our summary, or that's our webinar on the 4 pillars. We're going to now open up for some questions from you. Keep in mind that if we can't get to all of your questions, feel free to email us, and I'll be happy to try to answer those questions. Okay, some questions coming in. This first question is pretty specific compliance question, so I think it might be one for me, Greg, but if you have comments, feel free.
Sure.
Does the OIG recognize electronic training as valid? And I think what you mean is maybe this, like a video or something that can be emailed out through a learning management system. The short answer is yes. They do comment, though, not to use it exclusively. So I think that is hitting a little bit on these informal types of learning. One specific citation that I'll give you is if you go look at some of the most recent corporate integrity agreements, and when you get to the training and education portion, they'll say, okay, you have to do annual training on this topic or on that topic. It can be electronic, but you must make individuals available to answer questions to those who complete the training. So it's a good way to kind of get some things done, but even the OIG is saying just this electronic training that goes out in an email is not going to be enough. You need to be available and make human beings available to answer questions. A coach or a mentor, right? That informal.
Yeah, for sure.
Any other thoughts on that one?
No, I think the idea of that, you have this, you send a video out and you have someone to coach and to provide answers and context is key.
One thing that I used to do once I was able to build some good relationships in an organization, I would try to find that deputy compliance guy in the department. I remember one department, my plastic surgery department, is a department of about 20 docs. Well, there was one doc who would call me up and ask me questions, and he seemed somewhat interested in it, which is kind of unique for compliance and a physician. So I kind of made him the coach or this mentor within his department. I'm not in that department on a daily basis, but he is in the OR and he is in the recovery room with all sorts of other physicians, and so you can kind of deputize them and have them be that mentor. It doesn't always happen, but if you can build relationships with certain people, having a champion that's out there can be a really, really good thing. Here's a question, and Greg, maybe you could address it. It says, what could a trainer suggest to the audience to do for self-tracking or assessment after an informal training without a quiz or test? So I think maybe what they're getting at is there's not a formal quiz or test,
right.
But there's informal learning going on. How can a trainer suggest to an audience to self-track or self-assess?
That's a really good question, especially since most learning management systems don't account for that. So, I mean, there are a couple of things. One of the things that we've had people do is they keep learning journals, or their way of just kind of keeping track of the things that they're learning and kind of allow them to reflect. I think that's an important thing. I could suggest some technologies that are specifically designed, that we've designed actually here, that allow for you to track both formal and informal learning. I think
that's interesting.
There's some technologies available.
And there can be some real value to that, I think. I know that one thing that I did, and maybe I wasn't consciously aware that I was doing it, but whenever I found a valuable resource or something that I learned, I always have these folders. Originally they were paper folders, and they were by topics, and then now what I do is I have it, so if anyone looks at my directory of my folders, they're like, dude, you gotta tone it down a little. But I drag and I drop things into those folders by topics because they're things that I've learned, and maybe that's my electronic journal.
That's your electronic journal, exactly, and kind of your learning pathway. And just imagine if you had a place that you could keep that and share it with others, and that the learning manager could keep track of too. And
that would be
wow, this person's really engaging in these topics.
That would be great, yeah, because no one has access to those files of mine. Sure. If there were a shared place where you could share that, you could then get this synergy of learning amongst others as well.
Right. So I think that's a
excellent. Excellent. Here's a question. It says, can a combination of question answer, i.e. multiple choice, and typed response promote further understanding. So I think they're getting to the assessment piece. Does that make sense?
So, yeah, with assessment, I think always like to assess in more than one way. So multiple choice will help you diagnose and determine whether someone has learned the material. The open-ended feedback being able to respond in more of a written way allows see if they can apply and they really understand the material.
Yeah.
So if your learning goal is recall, multiple choice is awesome. If your goal is more of a do you understand and can you apply, I think allowing them to provide more a written response is better.
Good, thank you. Here's one that I think is maybe one for me, but you're welcome as well to answer. It says, my employer does not offer training unless it's free and on our own time. Am I at risk for compliance? We have no compliance officer. So the OIG is flexible. They allow you as an organization to be flexible. Let's say you're a one-physician practice. Is it required that you have a full-time compliance officer? No. What the OIG recommends is that you have somebody responsible for compliance duties. Training is a part of that. Do you have to spend an inordinate amount of money? No. The OIG is very clear that the complexity of your systems and the things that you use can be commensurate with what your organization's resources are. So and I'd be happy to take this offline if you want to email me and I could assess a little bit more about your specifics if you want. But in general, not necessarily. And I think there's a lot of great ways to demonstrate learning and training without spending a ton of money. I know CMS does free webinars. And I can send you some additional things if we want to talk about it offline.
There's a lot of resources available that are free. And if you keep track of what you're doing and you're learning and how you're changing your organization, I think that provides would provide evidence for learning and compliance.
That's right. And if you're the champion within your own organization, maybe you provide the training, right? It's about educating people on what you've learned.
Right.
So. Good. I think we're to our last question here. And here's one. Are there absolute rules that training on certain topics has to be done annually? So, law, I guess is what you may be asking, or regulation that says you must do annual training. Not really. There are some organizations that do say that, like there are some Medicare Part D and Part C programs. You're certifying in your compliance certification that you're doing certain training on a certain frequency level. But in general, no. But it is really an industry best practice that you're doing training on certain topics at least annually. So it really is a best practice. And if you read some of the settlement agreements and the CIAs by the government, they do frequently require those organizations, they've already gotten in trouble, they require those organizations to at least do it annually. Okay?
So one more question in here, and someone has asked whether there are specific technologies or guidance you'd have on selecting technologies to help facilitate this sort of learning. And I would just recommend you go to helpthecity.com and under our training our training link, and we have specific technology that we've developed that will help with this. And if you have questions, I'm happy to answer those questions independently as well. So.
Thank you. I think we've really been fortunate to have Greg here and have somebody who is involved from an expert perspective of learning, helping us design training tools. That's a real luxury, I think. So with that, Justin, I'll turn the time back over to you.
All right. Well, thank you both, Greg and CJ, for the presentation, and thank you to everybody for joining today's webinar. If you do have any questions that weren't answered, please direct them to CJ at cj.wolf@helpthecity.com. But if we weren't able to answer your question, don't worry. We just invite you to subscribe to the Help the City blog, where we will be answering unanswered questions in future blog posts. And we also just launched a poll, which you should be able to see on your screen now. If you would just take a moment to rate this webinar on a scale of 1 to 5, 5 being the best of how informative it was. These polls do help us improve our webinars, and we greatly appreciate your feedback. Again, we will be emailing everyone an on-demand recording of the presentation that you just saw, as well as a link to download the slide deck. So keep an eye out for that email, and thanks again.